If you're over 60 dealing with brain fog, memory slips, balance problems, or a sudden change in personality, here's what I would do differently today. I would stop asking, is this just aging? And start asking, what medications quietly changed your brain? Because what I've seen again and again is that many people labeled with early dementia weren't degenerating, they were reacting to prescriptions that were meant to help them. And this matters now, not years from now, because once that label sticks, medications tend to pile up, the narrative hardens, and the window to reverse course quietly closes. So the real question becomes, what if the problem was never your brain in the first place? I'm Dr. Fred Bloem, a holistic and integrative physician in Maryland. If you haven't done so already, I invite you to like and subscribe to the channel if this kind of content is helpful. Sign up for the newsletter if you want deeper explanations like this delivered directly to you. Now let's slow this down and talk about why this topic matters so much. Cognitive decline is one of the most frightening experiences people face, not because of pain, but because of identity, memory, clarity, independence, personality, and the quiet fear of losing yourself. What often gets missed is that the brain is exquisitely sensitive to chemistry, especially as we age. Many medications were tested in younger populations over relatively short time frames, without seriously asking what happens to the brain after years of exposure, particularly in a body that detoxifies more slowly. Patients are often told, this medication doesn't cross the blood-brain barrier, or that side effect is rare, or you've been on it too long for it to be the cause. But real life doesn't work like textbooks. What I see instead are people who slowly lose clarity, confidence, and function without anyone stepping back to connect the dots. They're told their labs look fine, their imaging is unremarkable, and that this is simply what aging looks like. If you've ever felt confused, frustrated, dismissed, or quietly worried that something deeper is being missed, you're not alone, and you're not imagining it. Earlier in my career, I trusted medication lists more than patterns. If a drug was commonly prescribed, FDA approved, and considered standard of care, I assumed the problem had to be somewhere else. What I didn't fully appreciate then was how cumulative effects matter far more than isolated side effects. Experience changed that. Over time, I began noticing patterns that became impossible to ignore. Cognitive decline that started after medication change, memory issues that worsened despite normal brain imaging, people labeled with early dementia who improved, not dramatically, not overnight, but meaningfully when certain medications were reduced or removed carefully. That's when my thinking shifted. Now, when someone comes in with brain fog, confusion, falls, emotional flattening, or early cognitive decline, my first question is very different. What has your nervous system been exposed to every single day for years? And this is where I want to be very careful and very respectful, because naming examples can help people orient themselves, but it needs to be done gently. I'm not naming these medications to scare you, and I'm certainly not saying they're bad, wrong, or never appropriate. Many of them can be very helpful, and some are life-saving. But what experience has taught me is that they are not neurologically neutral, especially with long-term use, aging brains, or when several are combined. One group I pay close attention to are medications with anticholinergic effects. These interfere with acetylcholine, which is critical for memory, attention, and learning. Examples people often recognize include Benadryl, bladder medications like oxybutynin, and older medications such as amitriptyline that are sometimes used for pain, mood, or sleep. Used briefly, these may be fine. Used nightly for years, I've often seen them quietly cloud cognition. Another group are benzodiazepines and sedative medications. These enhance calming signals in the brain, which can feel relieving at first, but over time may suppress alertness and memory formation. Common examples include Ativan, Xanax, Klonopin, and sleep medications like Ambien. Clinically, I've seen associations with slow thinking, balance problems, emotional flattening, and increased fall risk, especially with long-term use. Then there are over-the-counter sleep aids, which often surprise people. Products like Tylenol PM or Advil PM feel harmless because they're familiar and easy to buy, but many contain the same anticholinergic ingredients that affect memory and clarity. I also pay attention to certain antidepressants and antipsychotic medications, not because they're wrong, but because context matters. For example, paroxetine has anticholinergic properties, and some medications originally prescribed for mood or agitation are later used simply to help someone sleep. Over time, that can come at a cognitive cost. And finally, opioid pain medications. Drugs like oxycodone, hydrocodone, or morphine can be appropriate in specific situations, but with chronic use, especially in older adults, I often see brain fog, slowed processing, and increased fall risk. What's important to understand is that it's often not one medication, it's the combination. A sleep aid and a bladder medication and something for anxiety and something for blood pressure, each reasonable on its own, but together they can overwhelm a vulnerable nervous system. I want to be very clear here. I am not saying these medications cause dementia, and I am not saying anyone should stop medications abruptly. What I am saying is that I've seen many patients whose cognition changed after long-term exposure to medications like these, and whose clarity improved when the total neurological burden was reduced thoughtfully and safely. This isn't about blame, it's about better questions. Questions like, why am I still on this? Is this still necessary? And could this be affecting my brain? This gets missed not because doctors don't care, but because the system isn't designed for this level of integration. Medicine is time-pressured, siloed, and protocol-driven. One physician prescribes for sleep, another for bladder symptoms, another for mood, another for blood pressure, and each decision makes sense in isolation, but no one owns the total neurological burden. There's also an over-reliance on imaging and reference ranges. If the MRI looks clean, the assumption is that the brain must be fine, but function often declines long before structure does. And when symptoms worsen, the reflex is often to add another medication. That's how people end up on 5, 10, sometimes 15 prescriptions, all interacting with the same nervous system. When you see this earlier, everything changes. You stop chasing labels and start restoring physiology. The focus shifts from habit to necessity, from stacking to sequencing, and from suppression to nervous system recovery. Often the first improvements aren't memory at all. They're better balance, clearer speech, improved emotional presence, fewer falls, better sleep architecture, and a return of engagement with life. Those are neurological wins. And sometimes, quietly, steadily, clarity follows. Not because we added something, but because we removed what didn't belong. This doesn't apply to everyone, and nuance matters. Some medications are essential. Some should never be stopped without guidance. Some are absolutely appropriate. This is not anti-medicine, it's pro-discernment. This perspective matters most if cognitive changes begin after medications were started or increased, if symptoms fluctuate rather than steadily decline, if imaging doesn't match lived experience, or if the decline feels too fast or simply out of character. Every medication deserves periodic reevaluation, especially when the brain is involved. If there's one thing experience has taught me, it's this. Not all cognitive decline is degeneration. Some of it is reversible signal distortion. And when we slow down, listen carefully, and respect the nervous system, people often regain more than anyone expected. So I'll leave you with a few questions. Has anyone ever reviewed your medications through the lens of brain function? Did your symptoms begin after something was added rather than before? And would you want a deeper breakdown of how specific drug classes affect cognition? If this resonates, I'd love to hear your experience in the comments. Your story may help someone else connect the dots sooner.